Good morning. I'm Dr. Dale Dangleben, and on behalf of Patient Choice in Chemin, Neuf, Pointe, Michel, this is the medical tidbit of the day. Last week, I spoke about autoimmune diseases, and I said, this week I would, zone in on a couple specifics. So today I want to talk about the lupus, and it's one of the most, I guess, better known chronic autoimmune diseases. All right, and again, just to reiterate, the autoimmune disease is when your own immune system attacks itself. All right, and lupus is funny because it affects many systems. Right, there's different types. Right, by the way, but SLE, the systemic lupus erythematosus, is the most thought of and most common. Right. There's cutaneous lupus, which is just limited to the skin, all right, which does not have all the detrimental effects. There's some drug-induced lupus type, right? But let's concentrate on SLE, which affects the skin, the joints, the kidneys, the heart, lungs, brain, and that's why these patients have a very hard time. And we need to educate ourselves as much as possible about these things. I just want to go into a little basic science in terms of what happens, right? So in a healthy immune system, as I mentioned before, self-tolerance means the immune cells have to recognize your own body cells, right? The proteins and et cetera, and leave them alone. In lupus, this does not happen, right? We have what's called the B cells, the letter B cells. They start producing autoantibodies against the body's own system, okay? And we also have the T helper cells, which is also an immune cells, CD4, which wrongly supports the B cell instead of suppressing them. So the T cells and the B cells are sort of arming up against your own body, right? And these autoantibodies in lupus, if you ever get blood work and you want to understand what it is, you might see something called anti-dsDNA, right? That tells you about the disease activity, how active it is. There's something called anti-Smith, which is SM antibodies. There's anti-phospholipid antibodies, all right? And all these autoantibodies attack your own cells. It's a very complex situation where it attacks the kidney, causing lupus nephritis, which is inflammation of the kidney. You get the lupus, the skin rash, the malar rash, and everything else. The joints, you get severe arthritis. The blood vessel, you get inflammation of the blood vessel called vasculitis, and that's why it affects pretty much every organ system when that happens. So who gets lupus? Mostly women, right? Women are 9 times more likely to develop lupus than men. And most cases are diagnosed between the ages of 15 and 45, and it's more common and severe in blacks and Hispanics, okay? That's a fact. So remember that. There is a genetic predisposition because there's family history, all right? And especially if there's autoimmune diseases in the family for some reason. There's been studies that shows that there might be environmental triggers, right? Extreme sunlight, the UV rays. We know about that. That can cause, fractures in the DNA and cause mutations, right? Stress can trigger the symptoms, but not necessarily a cause, all right? So just things to know. What are some of the symptoms? It can be dormant, and unless you have a flare-up, you can have a short flare-up and go into remission, but the common symptoms are extreme fatigue. You could be running low-grade fever and don't know why, right? Fluctuation of your weight, unexplained weight changes. The butterfly rash across the cheeks and nose we talked about, right? You might have a photosensitivity rash after sun exposure, ongoing hair loss, joint pain, right? And your internal organs can be affected, and obviously that might take time to manifest itself clinically, right? Chest pain, from the lungs and the heart having inflammation. This is really an inflammation-driven problems. All right. And once you start having neurological symptoms, the headaches, the mood swings, the seizures, you're talking for more, advanced disease. Unfortunately, there is no cure for lupus, but early diagnosis, proper management can definitely improve your quality of life and reduce your complications. All right, so treat the symptoms of inflammation. All right, I talked about NSAIDs before. There's studies that shows the anti-malarial drugs such as hydroxychloroquine can control flares. All right, so the corticosteroids, right, which is a steroid, can also help, for acute flares, and it's shortest time, possible, effective dose, etc. All right. There's a whole slew of immunosuppression, and I know folks might say, well, I don't want to be on these meds, but unfortunately, there is no cure, right? So these medications are out there. Some of them can be hard on the system, right? Especially methotrexate, azathioprine, those type of medications when you have advanced lupus. This is really to suppress your immune system, and if you suppress your immune system, then you really, at risk for infection and things like that. All right. So the key is lifestyle management. Avoid prolonged sun exposure. Right. Be on an anti-inflammatory diet. Balance. Lots of vegetables. Lots of omega-3 like sardines and mackerels and things like that. All right. Try to maintain a regular, gentle exercise. Walking, swimming, yoga, all these things. Get adequate sleep, stress reduction. Try to get into meditation and breathing exercises. If you're smoking, quit that immediately. All right? So these are just some of the things that I wanted to bring up today for lupus. All right? So again, there's been advances in the diagnosis and the treatment, but you have to stick to the regimen. You can't say, well, I feel a little better today, I'm just going to... No, once you have a flare-up, it can do significant damage. You want to protect your kidneys, you want to protect your lungs, and you don't want to get into the neurological systems, at least to slow that process down. You want to stay informed, and you want to understand your disease as best as possible, okay? It's a lifelong condition that you have to deal with, so that's all I have on lupus today. Have a great day. Let's continue to support each other in any way that we can. Peace.